Welcome to the channel. I'm a doctor. I've seen things that don't always fit into textbooks. Moments that no protocol can prepare you for. Some of these stories are my own. Others were shared with me by colleagues, nurses, paramedics people, who, like me, carry the weight of these moments long after the shift ends. This channel is a window into those stories. Stories told in the break room, when the adrenaline fades and you're left wondering what just happened. I'm about to tell you it happened on one of those days that starts off like any other until it's don't. This is the story of a young lady who walked in with nothing more than a fever. Nearly didn't walk out at all. It was one of those mornings that almost feel too calm. Asterisk, a Tuesday, mid-morning. Triage was moving along at a comfortable pace. No traumas. No codes. Just the typical stream of patients we've all come to expect. Sore throats, stomach bugs. One sprained ankle from a step gone wrong. I remember sipping my second cup of coffee when picked up her chart. Female patient, teenager, chief complaint. Fever and fatigue. Vitals were unremarkable at first glance. A temperature, 38.6 degrees Celsius. Heart rate, a bit fast, resting somewhere in the 110s. Blood pressure, normal. Oxygen, fine. It read like 1,000 other charts I'd seen before. Probably a simple virus, I thought. Flu season was making its rounds again. But as I stepped into the room, something caught me off guard. Not something dramatic. Just feeling. She was sitting upright on the stretcher, earbuds in, scrolling on her phone like any other teenager, waiting out an annoying doctor's visit. There was color in her cheeks more from the fever than from health, and her skin had that washed out, it's a pale undertone that the fluorescent hospital lights only made worse. But it was her mother's expression that gave me pause. She wasn't frantic, but there was an uneasiness in her eyes, a tension. The kind you notice when a parent senses something's wrong, even if they can't explain it. "Hey, Doc," the girl said, offering me a faint smile. It wasn't sarcastic or guarded. The way teenagers sometimes are. It was tired. Her voice was low, and her breathing was quiet. Steady but shallow in a way that made me want to look twice. No sore throat, she told me. No cough, no vomiting, just tired. Really tired. She said the fever had started the night before, and since this morning, everything just felt heavy. Her body, her head, even her thoughts. Like she was wading through something thick and invisible. During the exam, her lungs were clear. Abdomen soft. But when I palpated her lower belly, she flinched just a little. "Does that hurt?" She nodded a bit. Mild tenderness. No rigidity. No rebound. Nothing to suggest something surgical. Maybe a urinary tract infection, I thought. Maybe it's just early. Maybe it's nothing. Still, something made me pause again. We ordered a flu swab, some basic labs. I told them we'd keep her for observation while we waited on the results. It all felt precautionary, routine. There was no red flag in her chart, no siren in my head. Not yet, just a teenager with a fever, a pale face, a mother who looked like she wasn't fully breathing, nothing urgent, or so I thought. Barely 20 minutes had passed. I was at my workstation. Halfway through reviewing labs for another patient, when a voice that sliced right through the comm, code blue. Bay. Code blue. Everything stopped. There's a kind of silence that follows a code blue call. A pause, only a split second where your brain tries to catch up to what your body already knows. Then I heard the second part. It's buried in the background. Teenager. Bay 4. My chest tightened. No, that couldn't be right. I stood. Up so fast my chair slammed into the wall. My heart was already racing before I even cleared the hallway bay for her. The girl with the fever. I turned the corner, and the scene hit me like a wave. She was slumped on the stretcher, eyes rolled. Back, skin suddenly ashen and waxy. Her chest rose and fell in shallow gasps, each one weaker than the last. The monitor above her was blinking red, alarm screaming, oxygen saturation, 60s and dropping. Her pulse was barely there, thready, flickering. A nurse was already at her side, voice sharp and urgent. She said she felt dizzy, Tried to sit up and then collapsed. No warning. I didn't even remember moving, but suddenly I was at the bedside. "Bagger," I shouted. Someone handed me the ambu bag and I started ventilating her as her chest barely rose. "Push epi. Get me a line. Now." Another nurse sprinted in with the crash cart. The noise blurred into a mix of orders, alarms, and the clatter of supplies hitting the tray. We were trying to stabilize her, but I couldn't shake the thought screaming in my head. This doesn't make sense. Just minutes ago, she was sitting up, smiling, talking. She was pale, sure but stable. She had a fever. Not this. Not this. I looked at her mother, now frozen outside the curtain, hands clamped over her mouth in horror. Her eyes met mine, begging for an explanation I didn't have. Inside, I was trying to keep my voice level, my hands steady, but everything about this was wrong. We checked her airway still open, heart barely hanging on. Her extremities were cool, mottled, like the blood was retreating. The pulse ox kept dropping. We squeezed the bag, started for fluids, drew labs. Blood pressure was crashing. What were we missing? We were running out of time. We didn't have the luxury of time. Her breathing had all but disappeared. She was barely oxygenating, her chest barely rising even with the bag. She needed an airway now. I called it, "We're intubating." Room went silent for a breath, then movement, and someone handed me the laryngoscope. Another nurse prepared the meds. I slid the tube in, her vocal cords pale and still, no resistance. Secured, bagged, oxygen climbing, but not enough. Then I looked up at the monitor. Blood pressure, 72/38, and falling heart rate, 150. She was tachycardic, just trying to compensate. Then, out of nowhere, her pulse nosedived. 140, 128/90. 60. It felt like free fall. Push epi. Wide open fluids go. The nurse's hands were already moving. We hung bags. Drew blood. Sent cultures. I was rattling off orders, but inside, one question echoed over and over again. What the hell are we treating? Because none of this made sense. She wasn't immunocompromised. She had no chronic illness. She walked into this on her own feet. And now we were fighting to keep her heart beating just then. The first batch of labs started loading into the system. White blood cell count, critically high. Lactate, CRP, through the roof. Platelets, crashing, normal. She was starting to clot and bleed at the same time. This was full-blown sepsis. But from what? I turned to the nurse nearest me. My voice was calm, but urgent. Check her skin. Rash, petechia, anything. She pulled back the blanket and looked. And then, doctor, she said, her voice lower, look. Tiny red dots, scattered across her inner thighs, climbing upward. Pinpoint, non-blanching, just beneath the skin. Peckakaker. Not many, but enough. For me, it was enough. That's when everything crystallized. Like a needle of ice sliding down my spine. I looked up. Get infectious disease down here. Now, this isn't flu. This isn't just sepsis. I paused, heart pounding. This was worse. This was meningococemia. A rare monster. Silent, fast, and almost invisible till it's far too late. She hadn't just walked into RR with a fever. She'd walked in with a time bomb. Meningococemia. Rare, fast, ruthless. Caused by Neisseria meningitidis, a bacteria that can live harmlessly in the nose until it doesn't. When it enters the bloodstream, it can unleash a storm. Sepsis. Coagulopathy. Multi-organ failure. And in teenagers, it can go from healthy to catastrophic in under an hour. That's exactly what happened to her. She had no stiff neck, no photophobia, none of the textbook signs, just a fever. And now she was fighting for her life. We loaded her with ceftriaxone and vancomycin, gave steroids. She was still intubated, sedated, but at least her vitals began to stabilize. Called the ICU team downtown. She needed to be in a higher-level facility fast. Her mom stood in the hallway, tears running down her face, unable to process what was happening. She just had a fever, she kept saying. She was fine this morning. I didn't have anything. Comforting to say because I didn't know if she was going to make it. She was transferred within the hour. I didn't sleep that night. I couldn't. I kept checking the chart remotely. She survived. It took 2 weeks in the ICU and another month of rehab. She lost part of her toes to necrosis from the vasopressors. But she survived. When I saw her again weeks later during a follow-up, she gave me the same smile. This time, weaker but real. They say medicine is a science, that it's about evidence, data, protocols, about steps and flowcharts and algorithms that lead you to the right answer. Most of the time that's true, but then there are days, like this one. Days that take every ounce of confidence you have and twist it until all that's left is a kind of raw, quiet humility. Because that morning, I almost sent her home. She didn't look that sick. A teenager with a fever, tired but alert. Nothing dramatic. If she'd waited even one more hour, if we'd missed the signs, she might not have made it. Some conditions move faster than we do. They wear the mask of something harmless, until they hit like a freight train, and every once in a while, one of them slips through the front door smiling and leaves you standing there, breathless, trying to catch up. It humbles you. It makes you look closer. And whether you realize it or not, it changes you. Thanks for listening. If this story made you think Cora feels something, consider subscribing and comment. These are the stories behind the curtain. I've got more to tell.